I'm Dr. C. Everett Koop, and I'm very pleased to have the privilege of introducing this film. On the Edge of Being, Physicians with Cancer is a documentary which speaks to us as caregivers. Its humanitarian focus offers sensitive insights into the challenges of patient care, particularly for patients who are terminally ill. The physicians in this program share with us a whole range of experiences. Though we cannot, nor would we want to, put ourselves in their places, they do ask us to be receptive to their suffering and individual anxieties, so that each of us might renew our commitment as caregivers and healers as we practice the art of medicine.
There simply is nothing that will take the place of having been a patient. Your perspective and the way you are dealt with in the world changes abruptly.
I make a transition from a high-functioning human being to a hospitalized patient. It's the hardest time for me. It's the greatest transition. It's a very private time, and it's a very difficult time.
You know, real empathy does involve putting yourself in that person's place, saying, what if this were me? What if this was my mother, my child? And it's hard to do that.
Serious illness, like cancer, is a common denominator of our lives. It does not ask the color of our skin or the language we speak. It does not respect wealth or power. Yet our culture offers us little help in coping with the specter of life-threatening illness. Perhaps no one has better insight into this dilemma than doctors who become seriously ill themselves. In this program, you will hear the experiences of 6 physicians who have confronted cancer. At the time of filming, 2 were cured, 2 were receiving treatment, and 2 had lost immediate members of their families. They spoke candidly with Dr. Norman Straker, a psychiatrist specializing in the treatment of patients with cancer. Their stories point to the many issues facing physicians as caregivers. Issues such as the doctor's relationship with the very sick and sometimes dying patients. The need to refocus medical education on the care of the whole person. The importance of providing emotional support and relief from physical pain. Anticipating the patient's fear of abandonment. And the physician's own vulnerability to burnout. As care seekers, these physicians experienced firsthand the trauma of critical illness. Their stories are both meaningful and unsettling, and shed light on many of the difficulties doctors face in caring for seriously ill patients.
My own malignancy occurred when I was an intern on OBGYN. It seemed evident that it was probably malignant, and I think my main concern at the time was my wife was pregnant, and I think my main question was and goal was to live long enough to see the child born.
It was the experience of being a patient with cancer that has made Dr. Balfour Mount acutely aware that doctors need to confront the many issues their patients face.
I think it is true, nothing quite so focuses the mind as facing the firing squad, and having been a patient, it has perhaps alerted me to some of the attitudes I may have inadvertently had through my training, conditioning as a medical student, as a young physician. Perhaps so. To be a patient or to have a loved one very sick soon reminds one, I think, that we really are whole persons, and we come as a community. We come with our baggage to illness. And to have experienced that, it's strikingly evident. To be in a setting of walking with the patient and family through that transition zone from where cure is the expectation to realizing that perhaps my time is limited. That transition is extremely difficult, and the medical and surgical oncologists deal with that every day. For those young medical students, doctors, for you and me each day, for our colleagues in all professions, the daily reminder of illness, of death, of not of being sick, I think is there, and I think we need defenses to help us with that.
My disease process is on the edge. I mean, we follow chest x-rays. My chest x-ray is on the edge. We're not talking millimeters here. We're talking about, I'm on the edge. So
Dr. Peter Morgan is an internist at the State University of New York. He had just completed his residency and accepted a fellowship in hematology oncology when he became concerned about a pain in his right leg.
Just passed the internal medicine boards and thought that it would be an appropriate time to get checked out. I was diagnosed with right lower extremity synovial sarcoma. Back in October a year ago, I was given 6 months to live. So here I am today, a year later, with a new world, a continuum of my last one, but essentially a new world. You get to choose how you want to approach this new world. And you don't ever have to engage it at all. You can just sit back and just let time go, or you can orchestrate how you want to live again. And that's what I did.
And has it gotten better or worse or the same?
It's stable.
It's stable. I mean,
The truth of the matter is I love medicine. I love the physician-patient interaction. I mean, that's a mainstay of my existence. As soon as I'm out of the hospital, I go back to work. I've gone from getting the IV pulled out of my arm at 9 in the morning to being at work at 11:30. Now, that wasn't a good day for me, but you got to do what you got to do. I live, then do what I got to do in relationship to this disease.
He was a very outgoing, lively child, very active and self-confident, very warm.
He was interested in how other kids felt already, and he was just a happy kid, really. We look back at pictures of him before he got sick, and he always has a big smile on his face. He's a happy kid.
Dr. Julian Offsay practices psychiatry in Hartford, Connecticut. His wife, Jan, is a registered nurse. Their years of medical experience could neither protect nor prepare them for the moment that they learned their 3-year-old son had leukemia.
I don't think it ever crossed our minds that that was the situation that we were about to be in. I don't know whether our denial was so great or, it really didn't occur to us that that was what was happening. I think because the first blood work, people had said, this isn't leukemia, it didn't look like that, But by the next morning, the minute that we went in for blood work, and the minute that I saw the oncologist's face, I knew that we were in for very big trouble.
When he offered us a 50-50 prognosis, Timmy's prognosis would have been 0 10 years before. So 50-50 was great, but 50-50 wasn't so great for us.
Timmy had, I think, something in the range of 17 spinal taps during the time of his treatment. He screamed and hollered through every single one of them, and it was just a horrible, horrible thing.
He wasn't prepared. There was nothing used to reduce the pain. So if you don't do something to reduce the pain with some kind of analgesic, maybe you can never prepare the child, but at least you can try. So I think that people who are very well-meaning and very concerned are so focused on the fact that they can actually cure you that they don't really think so much about what it takes to do that. And they also don't think about the fact that some of the children are not going to be cured, so that they're going to have all of this terrible stuff done and then they're going to die anyway.
There are some people around the country who are really trying to say, hey, wake up, guys. Kids have pain too. And we can't just act as though they don't have pain, that they don't experience the way adults do or whatever. Kids have pain. And it's important for somebody to think about that. So that I think it really falls on the shoulders of the medical people themselves to be more sensitive to the fact that this is a child. It could be your child. And would you want this done to your child?
Any other choice? She looks great.
For 22 years, Dr. Saul Cohen and his wife Maria shared a medical practice in New York City. Many of their patients were elderly with a variety of ailments, frequently life-threatening. Then, in 1987, Maria developed breast cancer.
My wife, being a physician, knew a great deal about her illness and more or less how she was going to die, because she had seen her sister die, and her sister had predominantly the same illness that she had. Our hopes were dashed one by one by one, and it was inevitable that she would die. At the time my wife was dying of breast cancer, I was taking care of a patient who I had been treating for some 12 or 13 years who was also dying of breast cancer. And I mean, I would go to the hospital and visit her, and perhaps fortunately, she was an elderly woman. I mean, she was in her late 70s, so I think that was a bit more palatable. Had she been in her 50s or 60s, I think it would have been even more difficult. But having the experience I had at home, I was able to listen to her. And I was able to talk to her about death. And since her death, I see her husband periodically, and we basically talk about his feelings and how he's managing.
During the day, I'm in and out. I'm busy. But the evenings are rough.
Yeah, that's the worst part.
Yeah.
Do you sleep all right?
Yeah.
I mean, I know that having gone through the experience I've gone through, that it has made me a much better human being, a much better doctor.
It's as though there was a void next to me. I kept looking around. Because Helen used to sit, she never used to say a word. Just quiet. Sometimes she closed her eyes, but never spoke.
But it didn't matter.
The idea that she was there.
Yeah, yeah.
My own experience with my wife had an enormous impact on me. I feel I would be spitting on my life if I didn't personally do something in my behavior.
I've spent most of my professional life trying to teach myself and to teach others how it is to be a patient.
For Dr. William Webb, the journey began with a problem all too familiar for many patients: the agony of trying to obtain a definitive diagnosis. When his symptoms worsened, he returned to his internist who scheduled an MRI. The procedure confirmed a diagnosis of prostate cancer.
And sure enough, the radiologist says, I think you ought to look at this. Well, there it was. I mean, it was like Grey's Anatomy. I mean, you could see all of the tumor. I was absolutely devastated inside. I've never had anything hit me so personally. And I just felt weak and pain. And the worst feeling I had was how it was going to be to go home and share this with my family. I mean, they had no idea that I was in anywhere near this kind of jeopardy. I pretty much, I think, entered the last technological phase of my treatment. In other words, I think we are clearly at a point where the finding the magic bullet or finding the new drug or this kind of thing are becoming less and less part of the picture. Most of my colleagues, if they made any kind of error or mistake with me, they didn't do so because they were doing me any ill will. It was because I think they cared for me. They didn't want to accept the fact that I could be mortally ill because I was, in a sense, so closely identified with them. And I think that there are many stories throughout the medical profession that will support this notion that doctors cannot be totally objective with other doctors. And this is not out of fear of malpractice.